can't handle it. I whispered back, I am the storm. What is it that we can't do, dear women, once we set our minds to it? A very happy Women's Day to all lovely girls out there. Menopause, the second innings in play. I think it's that stage when we are either almost done with our responsibilities or at least we have a definite plan for it. I can see this time as the time to live your dreams. But then, as any transition, this is not an easy thing to do. Along with Dr. Mansi Chatrat, I have the honor of welcoming today Dr. Bindu Singla, MBBS and MS in her field. Dr. Bindu, please enlighten us on how to make this transition easier and healthier. My first question is, what is menopause? By what age do we expect it and what are the symptoms?
Hello everyone, wishing all of you a very happy Women's Day. Thank you Dr. Mansi for having me. Menopause, actually a biological process which becomes a problem for most of the females. Now this is diagnosed when a female goes without her menstrual period for 12 consecutive months. Menopause occurs when the ovaries stop producing two hormones, that is estrogen and progesterone, required for a woman's fertility. The average age of menopause is 46 years in India, but it can range anywhere from 40 to 50 years. Menopause can cause irregular periods, hot flushes, night sweats, mood swings, sleep disturbances, bloating, weight gain, and vaginal dryness. In severe cases, it can cause anxiety and depression. Experiencing hot flushes is a very common symptom of menopause. It's a creeping feeling of intense warmth that quickly spreads across your whole body and face, and may be accompanied with palpitations and a feeling of uneasiness. To reduce hot flushes, one should decrease the intake of coffee, tea, and spicy food, increase water intake, stop smoking and drinking, wear loose cotton clothes and stay in a cool environment. But if these measures don't help, the ultimate treatment is hormone replacement therapy.
Thank you, Dr. Bindu, for simplifying and making us understand what menopause is all about. But does menopause affect our heart health and our bone density as well?
Yes, unfortunately, menopause does increase the risk of heart diseases. This is again because of falling levels of estrogen and progesterone. But all you have to do is keep a strict check on your blood pressure, sugar levels, lipid profile, and visit your cardiologist at least once a year. Menopause can cause bone loss and chances of osteoporosis. So once a female starts reaching the menopausal age group, we should take vitamin D3, calcium supplements, and if the symptoms of osteoporosis are more, one should get the bone density done. If there is decreased bone density, then one will have to take low dose estrogen as a treatment.
What, according to you, Dr. Bindu, is the right time for a woman going through menopause to visit a physician?
See, a female has to realize that menopause is not a disease. It's a physiological process, and the symptoms which we experience are experienced by most of the women. So there is nothing to panic about the symptoms that a female is experiencing. But yes, if the symptoms become unbearable, that is the right time to visit your physician.
कई बार डॉक्टर बिंदु हार्मोनल थेरेपी की भी बात की जाती है, तो क्या हार्मोनल थेरेपी हेल्प करती है ड्यूरिंग मीनोपॉज? एंड आपके हिसाब से क्या सप्लीमेंट्स विमेन को लेने चाहिए ड्यूरिंग मीनोपॉज और मीनोपॉज के बाद?
Hormone replacement therapy can look after most of the symptoms of menopause. Sedatives will need to be given for managing the sleep disturbances. But after menopause also, one needs to continue calcium supplements, iron supplements, vitamin D3 and multivitamins. But of course, there is a solution always with the dietitian. So I hand you over to Dr. Mansi, who will tell you the natural remedies which will take care of most of the symptoms of menopause. Thanking you once again, Dr. Mansi, for having me.
Thank you, Dr. Bindu, for such insightful information. It was such a pleasure to listen to you and make our audiences listen to it, that menopause can be as simple as that. We just have to make few changes and the transition happens so easily. For me, another way of looking at menopause is rising above petty matters and hugging life back. It is the second innings, and let's make the most of it. And our kitchen is a huge clinic in its own right. And as Dr. Bindu mentioned, few changes here and there, few good foods that we could include timely in our diet, this transition can be very, very simple. So today we are going to cover about 5 foods which, if we include regularly in our diet, it helps us sail through the various symptoms of menopause. 5 things that maybe if we avoid, it could help us immensely, and 5 magical herbs which, if we have regularly, it can help us understand and tide over this phase of transition. Dairy becomes extremely crucial during premenopausal and menopausal stage. As Dr. Bindu rightly mentioned, that the absorption of calcium goes down. So to keep our density of our bones better, so that हमारे bones strong रहें और ये calcium का जो decline हो रहा है absorption का, उससे हमें नुकसान ना हो, we need to have more calcium rich foods. What can they be? Yogurt, cheese, milk. People who are not very fond of dairy, fish and eggs, or sesame seeds, beans, tofu, fox nuts, makhane, and sesame seeds is still. So we can include all these things in our daily diet and make our bones stronger. Then green vegetables and fruits. In any situation, green vegetables and fruits, they are full of calcium, vitamins, minerals, and they keep us stronger. Second most important point during menopause is to maintain your weight. Dr. Bindu mentioned that one of the symptoms of menopause is weight gain. So we have to walk that extra mile and ensure that we don't put on weight. Phytoestrogens. If we have foods rich in phytoestrogens, ये सारे symptoms को हम काफ़ी हद तक reduce कर सकते हैं. और क्या है rich phytoestrogens में? Flax seeds, अलसी, linseeds, sesame, तिल, hemp seeds, tofu. तो अगर आप ये सब चीज़ें अपनी डाइट में थोड़ा थोड़ा डेली रूटीन में इंक्लूड कर लेते हैं, तो एंग्जाइटी, हॉट फ्लैशेस, नाइट स्वेटिंग, स्लीपलेसनेस, कोलेस्ट्रॉल, हाई ब्लड प्रेशर, सभी में हमें काफ़ी हद तक आप देखेंगी धीरे धीरे आराम आ गया. Then protein plays a very crucial role in preventing the loss of lean muscle and keeps us stronger and also fuller when we have protein, and hence helps us to maintain our weight. So things like eggs, fish, paneer, cheese, dals, green moong dal, yellow moong dal, kala chana, rajma, green moong dal sprouts, tofu, a glass of milk at night. Not only does it give me calcium, protein, but it also helps me to sleep better. As Dr. Bindu mentioned, that loss of sleep can also be one of the symptoms. So have a glass of milk, a warm glass of milk at night, and you can sleep peacefully after. The fifth thing that you must include in your diet is whole grains. होल ग्रेन्स बहुत ज़्यादा रिच होते हैं, सारा बी विटामिन में, फाइबर्स में, नाइसिन एंड सो मेनी अदर मिनरल्स एंड वाइटामिन. तो ये तो बहुत छोटा सा चेंज है. इन योर डेली रूटीन, इंस्टेड ऑफ हैविंग जस्ट व्हीट, try to include some jaw, jowar, quinoa, and so all the brown rice. So all these whole grains will help you substitute or replenish all the lost minerals and vitamins in the body. Things that we must try to avoid during this time. First is sugar and sugar based products. Many studies have shown over the years that if we include more sugar in our diet, ज़्यादा मीठा या चीनी बेस्ड या शुगर बेस्ड प्रोडक्ट्स खाने से शुगर लेवल्स तो बढ़ ही सकते हैं इस दौरान, बट इट कैन ऑल्सो लीड टू डिप्रेशन. हमें डिप्रेशन हो सकता है, हॉट फ्लैशेस की फ्रीक्वेंसी एंड इंटेंसिटी दोनों इंक्रीज़ होने का डर होता है, एंड ये हमारे गट के लिए, हमारे डाइजेशन के लिए अच्छा नहीं है, हमारे वेट के लिए अच्छा नहीं है। सेकेंड एंड थर्ड थिंग इज़ अल्कोहल एंड कैफीन. Both are not good during this time. Both have several studies over the time have shown us that both caffeine and alcohol can tend to again influence the hot flashes and anxiety levels in us. So during menopause, it's better to avoid or at least reduce the quantity of caffeine and alcohol. Then spicy foods. Lot of spicy foods during menopause, which has lot of spices, would also lead to anxiety, hot flashes, and very uncomfortable feeling, and many a times even depression. Along with this, even high salt. When I say high salt, I don't mean don't put salt in your vegetables. I mean highly processed foods. They are naturally very high in salt. So try to reduce your salt intake, because salt intake is directly responsible for high blood pressure. Also, it more salt means a lower bone density. 5 herbs that I was talking about which would help through menopause. First is aloe vera gel. It's a magic gel. So you can have it natural, you can pick it up from the market, but aloe vera is rich in phytoestrogens and hence helps us to correct our hormonal imbalance. ऑल्सो ये हमें हाइड्रेटेड रखता है और बहुत सारे मीनोपॉज के सिम्टम्स को रिवर्स करने में हमारी हेल्प करता है. शतावरी. शतावरी इज़ अ वेरी वेरी यूजफुल हर्ब एंड हम लोग उसको नॉर्मली विमेन हेल्थ टॉनिक भी कहते हैं. बहुत इजीली अवेलेबल भी है as tablets or powder. You can have it with milk. Shatavari has amazing properties to help us with vaginal discharge, night sweats, anxiety, even mood swings. Dosage के लिए it's pretty safe herb, but फिर भी आप अपना health consultant को refer कर सकते हैं. Then fenugreek seeds, दाना मेथी, and it helps us in bloating. ब्लोटिंग बहुत ज़्यादा हो जाता है मीनोपॉज के दौरान. तो अगर आप दाना मेथी पानी रोज़ पी लेते हैं तो एक तो ये ब्लोटिंग नहीं होगा, साथ में दाना मेथी भी हमें हॉट फ्लैशेस को कम्बैट करने में हेल्प करता है. फोर्थ हर्ब आई वांट टू टॉक अबाउट इज अशोका पाउडर. Again, very easily available. This also has huge medicinal and health properties, and Ashoka powder, when consumed regularly, can help us combat the symptoms of menopause. For dosage, please do refer to your natural health practitioner or your health consultant. Finally, Amla. Amla, I've been speaking so much about in our previous videos as well. Amla not only rich in vitamin C, but also helps us build up our immunity, makes us stronger, helps my anxiety levels to stay away, helps in night sweats. To conclude this session, I thank Dr. Bindu once again for this amazing session and help women understand there is nothing to panic about. Menopause is not a pause, just a small hurdle which you can easily cross if we pay attention to what we are eating and how we are looking after ourselves. Have fun.
Thank you, Dr. Bindu. It was a pleasure to listen to you. I am sure all women would benefit from these insights. Thank you, Dr. Mansi, to make this look so easy with food. Once again, a very happy Women's Day. Please do remember to like, comment, and subscribe our channel. This is your host, Trisha, signing off.